Hi, Jeremiah Hales with Empower Physical Therapy. Today we're going to work on an exercise to help people with neck pain feel better. If you're suffering from postural neck pain syndrome, so if you've been looking at screens a lot, texting, typing on the computer, working from home, everything that's happening right now is always kind of in that seated, head flexed position. This is a great exercise for you. If you also have been struggling with cervical disc herniation, especially in the lower cervical spine from like C5 to C7 or T1, the upper thoracic spine, this is a really good exercise to help take pressure off of that disc and to help it heal. It's also going to help strengthen the front of the neck. So I've got my neck model here. I just wanted to demonstrate sort of how these joints line up. You'll see in the neck, I'm just going to bring the camera a little closer here. You'll see how these joints are actually set up to slide on one another. So if you look at this joint right here, you'll notice that it looks like a flat plate. And when you look up, it's supposed to slide back. So this top vertebrae, that's called a vertebrae, is supposed to slide backwards on the bottom one. And when you bend your head forward, it's going to slide forward. And a lot of people are stuck, actually. When you see people with a little bit of a hump on their back, what's happening is that this top vertebrae is kind of stuck forward and it's not sliding back very well. And that over time creates a lot of lower neck pain, and it puts a lot of pressure on the vertebrae higher, which can then of course create upper neck pain. So we want to try to fix that. And it's very mechanical and it's very fixable with a couple of simple exercises. So we're going to work on teaching this vertebrae to slide backwards on the lower vertebrae. And our goal will be to help improve that motion, help get rid of that sort of hunched back look, and help decrease your pain. The good news is that the exercise is super simple. It really is just, and it's kind of a funny looking one. I always laugh a little bit when I'm working on this with people because we always kind of joke around about how weird it looks. But if you have normal posture, your earlobe should be over your shoulder and your shoulder should be over your hip bone. So when people are kind of stuck forward like we're talking about, that upper vertebrae is slid forward and kind of stuck over the lower one. And so we want to get that upper vertebrae to slide back. Remember when we looked at the model just a moment ago? So the exercise looks like this. You're going to take your index finger and you're going to put it on your chin, and then you're going to rest your thumb on your sternum like this. So index finger is touching the chin, thumb is touching the sternum, and you're just going to slide your chin back. And this is where we like to kind of think it looks funny. So you're making a little bit of a double chin. So you're going to make a nice double chin and you can't talk, and then you're going to bring your head forward. Okay, so here we go. You're going to slide your chin back and you're going to slide your chin forward. Now, if you notice, what I'm doing is I'm literally sliding my head back. What I'm not doing is I'm not tipping my head up. And for those of you with a lot of stiffness in the lower cervical spine, this is going to be a tough exercise. So, and you'll feel it. You'll want to look up, but really fight that and try to keep that head level as you draw your chin back. And what I would like you to do is do somewhere between 5 and 10 of these in a row. So just sliding back, making a nice double chin. Do it in front of the mirror so you can see, and then bringing that chin right back. 5 to 10 reps, a couple times a day, especially if you're grinding on the computer and working hard, or maybe you're just watching a movie on your cell phone, let's be honest. But if you find yourself sitting a lot, looking at a screen, you're getting that achy pain in the shoulders, you're feeling super tight through the traps, this is a great exercise to help improve and restore the normal motion in your lower neck and your upper back to help you feel better. If you have, like I mentioned earlier, a herniated disc, something like that going on in your lower cervical spine, this is a great exercise to help restore that motion and help take pressure off it and help you get back on the road to feeling good. So if you have any questions, comment below, or certainly reach out to me and I'd be happy to help. Have a great day.